The problem is when you start specializing, you zoom in so much that you miss the whole picture. Welcome to the FlowScribe podcast, a show where we help you grow your clinic with practical tips for marketing, client support, and building treatment programs that you can passively use to turn your clients into raving fans and a referral army. Hey, this is Doc Yates. Welcome to the FlowScribe podcast, brought to you by FlowScribe.com. And today I want to discuss how specializing can be wrecking your practice and definitely wrecking your patient results. Now, just to clarify, I'm not saying that for each of the different fields of health that you shouldn't be diving into learning more about each one of them. The problem is when you only dive into one of them and lose sight of all the others, you are going from being more helpful to less helpful, unfortunately, because then at that point you're trying to tie everything into that one little box that you specialize in. You need to be able to see the full picture to make the connection. So I want to talk about 4 tips to consider when you are working to help a client and seeing the full picture. So 1, when you zoom in, you lose the full picture. So when you zoom in, you lose the full picture. And this is something you see all the time in regular medicine when someone gets referred. And to you, often the connection's the obvious, but someone gets referred from their GP to another person who maybe like an ENT, and the ENT is focusing on their sinuses, and they're like, okay, well, the sinuses are related, therefore, we've got a chronic sinus infection, so we're going to have them use these steroid nasal sprays, and they're kind of ignoring the whole fact that maybe the person has acid reflux, and the acid coming up is the problem. Or maybe this person has some sort of sensitivity to dairy. Or maybe this person lives in a moldy environment that's causing the issue. And all they're doing is like, oh, this is the area inflamed, so let's put the anti-inflammatory there. So you need to be looking at the full picture. The more you zoom in, the less you are going to see of that. Number 2, especially during that initial consult, and this is where the intake form comes in so helpful, you need to make sure that you're really looking for connections between all of their complaints and timelines. The timelines is key. Make sure when you're looking at the complaints, you have an idea in terms of what started first. If you can write that, a lot of time a good intake form can tell you all of this, which is great. So you can list the concerns in order of what's the most important to them, but then have a little note on the side where they can fill out when did that concern start or when did it start becoming worse. The other thing that you really want to make sure that you have a timeline for is medications, because you will find when you're looking at the full picture, so often one of the new main concerns that they're dealing with is related to a medication that they had started around that time. And those are the ones when you make that connection, the client's like, oh, yeah, it actually started exactly after that. And it makes for a very easy case and a very happy client. So look for all the connections between all of their complaints. So many times, like someone comes in with a complaint and you're like, well, they mentioned their neck, and I know that I'm really good with neck, so I'm going to focus on that. If you start ignoring all of their other concerns that might be related to their neck, even if it's just musculoskeletal, if they've got a foot issue and you're not addressing their foot and you're only addressing their neck, if they've got a posture issue and you're only addressing their neck, if they've got sleep issues and you're only addressing their neck, you are definitely missing the full picture, because there's so many things related to that. Could be so many neck issues that I've seen related to sensitivities, so many neck issues that I've seen that have been the main cause is because of hormonal imbalances. Those are the things that you have to look into. We're going to go into that in a little bit more. Number 3, if a treatment series fails, you're missing something. If a treatment series fails, you're missing something. So, and again, I said series, so you're not like you're expected to nail it right on the first go. But if you've been practicing for a while, you have an idea in terms of how many treatments it's going to take to see results. And here's the other thing that's important. The treatment series doesn't have to have been yours. So if someone else just came from another chiropractor and you are asking about what they did, and they're doing, maybe not the exact same adjustments that you would be doing, but similar things, and they've been seeing that person for a long time and they're not getting results, and now they want to see if you can do it instead. If your thoughts are just to think that, oh, I'm just going to do better adjustments than they did, chances are you're missing the picture, and chances are the patient's missing the picture. And that's why you're the doctor. You have to be the one who doesn't miss the big picture. So if a series has failed, Start looking outside the box of what the other series was treating. Number 4, make sure you're always asking about all of the fundamentals. Because someone didn't list it as a concern on their sheet doesn't mean that it's not an issue for them. A lot of times people get stuck on one or two things and they're just used to other issues. Sleep is a perfect example. There's a lot of people with really crappy sleep, and there's a lot of females with really bad hormone cycles. And for them, that's just how it's always been. So they don't think of it an issue because for them, they think that everyone has really bad cycles, or everyone has, pretty bad sleep, or digestion would be another example. So things you need to ask about: digestion and bowel movements. These are basic things. If someone's getting tons of bloating, heartburn, reflux, or constipation, which is something you really need to dive into with the simple question, do you go to the bathroom every day? Is it formed? Perfect. A lot of people have no idea that they're even supposed to go to the bathroom every day, and they think it's fine if they're going once or twice a week. I've had clients who only go once every 2 weeks, and the record is 3 weeks. Do you know how many of the rest of your body and systems will be off if you're that constipated? So you have to make sure you're addressing digestion. Then you need to make sure there's sleep. Ask about sleep. Do you fall asleep fine? Do you stay asleep? Do you wake feeling refreshed? Musculoskeletal. If you're a chiro, listen to this. You already know this topic inside and out. But ask about other aspects. Like, is there any other imbalance? Even if it doesn't seem related to your main concern, is there any other injuries that you've sustained? Any other musculoskeletal ailments, pain, injuries, stiffness? Just let me know about all of them, so that way you can make the connection. And chances are a lot of people haven't asked them the details about that before, because most people are in such a rush, they're just trying to get them out of their office instead of keep them in the office. Hormones is key. Hormones is absolutely key. The biggest thing for hormones when you're trying to build a picture is just to ask, do these symptoms coincide with your cycle? Do they get worse before your period? Are they worse after your period? You need to know that, because if you're noticing they're consistently going with the cycle, then you know that the cycle is playing a role in one way. And lastly, know about any medications, any supplements that they're on, because that, as we mentioned before, can contribute to a lot of side effects and a lot of other symptoms. So I'll just give an example, and this is literally just from yesterday. Someone came in with chronic low back pain, and I followed up with them finally again yesterday. So they came in, chronic low back pain, and they've been seeing a chiro pretty consistently, getting their SIs adjusted, their back adjusted, they're getting straightened out. And every time they would say, I would always ask, so tell me about the results of the treatment series that you had. And they're like, well, it would always feel good for about a day, and then everything would just kind of really tighten back up. And I've got a lot of pain and a lot of tension. Okay, what else do you have? They also had IBS and IBSD, so they always had chronic diarrhea and chronic digestive pain. No one had addressed it yet, and no one had even asked them about it. They were also chronically anxious. They're a very anxious person. When I ask about stress, they're like, yeah, well, they would when people will say that they're stressed, but then you start asking about the cause of their stress, and sometimes they're anxious about stressors that aren't that big of stressors. Like, well, of course I'm stressed. I'm, I have 2 kids. I'm like, okay. That's it. There was no there were kids with special needs. There were kids that have lots of problems. They were difficult kids. They had 2 kids, and that was a really big stress for them. What was the other stress? They had they were working as a teacher. That was very stressful. So when you start seeing that, and then you start asking, would you describe yourself as anxious? The answer is generally yes. So the person that was consistently anxious, they had IBS, they had this chronic pain, and they had chronic poor sleep. So after we kind of looked into this and put together the plan to work with their inflammation and IBS, their back pain took care of itself. And when you deal with the full picture that way, it makes it so that the treatments that you start doing in clinic, so the hands-on treatments will work so much better, and they will hold so much better when you've dealt with some of the other underlying issues like inflammation, in this case, low magnesium, dealing with their stress and anxiety, which lead to more tension and also increase their IBS. So it was like this vicious cycle, and you just had to break the cycle as opposed to just trying to pick your specialty and treat just that. So I hope this information was helpful, and I hope this has convinced you to start being more of a generalist. But don't just be a generalist. A generalist does not mean that you're diving in and looking at topics in detail. You're still looking at topics in detail, but you have to look at all of the topics in detail. Try and be a very well-educated generalist, not just a specialist. A specialist is not being an excuse to just look at the one field. Hope this was helpful. Doc Yates, signing off. Thanks for tuning in to the FlowScribe podcast. To learn how FlowScribe can help build your clinic, go to flowscribe.com.